This morning, there's some new information about the latest problem with Obamacare. This is the administration's scrambles to try and clear up data discrepancies the government says could jeopardize coverage for millions of people. The new Inspector General's report uncovering some 2.9 million flaws in the federal exchange. They say most of them deal with inconsistent information supplied by those who were signing up. HHS, though, has been unable to straighten out a whopping 89% of those data flaws. Congressman Michael Burgess of Texas is very invested in health care. He is a doctor and also serves as vice chairman of the subcommittee on health. You know, doctor, I love the phrase data flaws. You got nearly 3 million of them. I mean, they say they're inconsistencies. They could be simple mistakes, but I mean, let's be honest. Wrong information, inaccurate data. Could this be outright fraud?
Look, it could be a lot of things, but do remember data discrepancies translates into a patient who may not get care when they need it for coverage that they thought they had. This is the problem that must be corrected. And I will tell you from the committee's work, the number is probably higher than 3 million. It's probably closer to 4.
You think it's higher?
But these issues have to be resolved. Again, these are people who may think they have coverage and don't. Remember, it was about a year ago that we all remember the employer mandate being delayed. That kind of came down on 4th of July weekend. But around the same time, they also said income verification was going to be suspended, and we'll just trust people. Well, I trust people too, Eric, but, you know, we're finding out that maybe and these may not even be intentional. Some of them may be just errors. But the fact of the matter is they didn't build the platform correctly. They have not yet built the back end of the platform to deal with some of these issues. And as a consequence, as we get deeper and deeper into this first Obamacare year, and oh, by the way, we're going to start signing up for the second Obamacare year, these things have got to be resolved. The president came out right before Easter weekend and said, mission accomplished, I signed up 8 million people. Well, it turns out not quite, Mr. President, and some of those were in error, and some of those, as you say, may have actually been intentionally fraudulent.
Well, you know, of those 8 million people, about what, 2 million or so were actually the only ones that were uninsured, and other people had insurance.
Correct, and it will be interesting to see what the number of those sign-ups that actually had discrepancy. Look, let's fix the problem, and here has been the difficulty from day one with the Department of Health and Human Services on this. They refused to come in and be open and honest with us. Right before Obamacare went live, October 1st, the head of the Center for Consumer Information and Insurance Oversight came in to the committee and under oath said, yeah, everything will be ready October 1st. He knew at that point it wasn't going to be ready. There was no way it could be ready. He was lying to us. He lied to his boss. He lied to the president. A lot of people at HHS are now gone. I just don't understand why there were not wholesale firings. You have to ask yourself, what do you have to do to get fired in this administration? Because clearly there was incompetence par excellence that month.
Well, you talk about incompetence, but, you know, there's a big cheering section that says, look, people are being covered, people had pre-existing conditions, but take a look at what Investors Daily, pretty scathing and blunt editorial about Obamacare under government audit revealed vast Obamacare failures. Looking at just 45 randomly selected applications, the analysis found cases where income data were wrong, Social Security numbers hadn't been checked, citizenship or legal status hadn't been verified, and information was entered incorrectly. If Obamacare were a private company, you can bet its executives would be facing criminal charges. Instead, Obama and the press are cheering Obamacare as a great success. Do you think that criminal charges are actually warranted and that Obamacare is a great success?
I think the analogy there that if this were a private sector company, there would be government agencies who would be asking very hard questions with perhaps articulating some very severe penalties that might be invoked. Look, this thing, you're correct. People are now depending upon things they have been promised under the Affordable Care Act. It really is incumbent upon the administration. Be forthcoming, be open, be honest. Fix the problems as they exist. At the very least, you owe the people you promised this to, you owe them that. And we can argue about the politics of whether this is the right policy or wrong policy. But they have a duty to be forthcoming. They have a duty to fix this and stop with the political spin, stop with the talking points, and let's get to the bottom of these things and fix them.
Yeah, that would be the shame of it if someone thinks they're covered and they really need it, life-threatening situation, and they find out they're not. Congressman Michael Burgess, a doctor, thank you so much for joining us today.
Thank you, Eric.